Welcome to the first episode of my educational series, where I give you some insights and tips on how to deal with musculoskeletal pain, commonly referred to as just muscle and joint pain. I'm Dr. Israel, and as someone who treats musculoskeletal pain for a living, I want to share some tips and tricks that help a majority of my patients so they have a better understanding of how to live with their pain, more specifically how to live with it as they're recovering. And I want to share these tips and tricks with everyone else, so if you struggle with chronic musculoskeletal pain, you have a good base of knowledge to know what to do and what to look for going forward. So today we're going to discuss the four main causes of musculoskeletal pain, whether you're dealing with lower back pain, shoulder pain, knee pain. It all follows the same playbook as far as what's causing your symptoms. I'm going to discuss what each of those four are, and then also the best treatment modalities for each of those. So after today's video, you'll know if you're suffering with pain, when you should go to PT or a chiropractor, when you should get a medral dose pack or a steroid injection, or even an MRI if surgery might be the best option for you. So let's dive in. So I like to break the four main causes into four categories, each going from most common to least common. And that first one is what we call a mechanical driver of pain. What the heck is mechanical driver of pain? Well, think of that as movement based. For instance, if I have low back pain, if I do a specific movement, or I do something specifically mechanics based, it causes, we know, okay, there's a direct correlation between my movement and pain. We would classify that in the mechanical category. This is where most musculoskeletal pain lives. Based on my clinical experience, at least 90% of all pain that comes into my clinic is the mechanical nature, but there are some other options too. So how do we address mechanical pain? Well, we want to fight mechanical with mechanical. So this is where a sports chiropractor or a physical therapist would be your first line of measure to get over the hump when you're dealing with this type of pain. A skilled clinician will know within a week or two if they can help you. For instance, if you have movements that worsen your pain, there's a high likelihood that we can find the movements that actually help reduce your symptoms, improve your function, so that you can get back to doing the things you love as soon as possible. Now, luckily, this is the bread and butter of what I see all day. Super easy and straightforward. I mean, you could still have pretty intense symptoms, but as long as mechanics is the winner of your cause of symptoms, then you can recover pretty quickly. But there'll be some of you that don't get better with either chiropractors or physical therapy, and that leads us to our number two, which is our chemical driver of pain. Think of that as inflammation. Now, full caveat, if you're dealing with pain and symptoms, there's going to be inflammation involved, but it depends on how much inflammation is involved. For instance, if inflammation's too high, usually your movements are very, very limited, and a lot of them cause pain, where you can barely even bend forward, or even rotate your neck if you have a very stiff or painful neck. That's when we know chemicals winning. Now, 1 and 2 go hand in hand, where if you have movements that hurt, movements can cause more inflammation. More inflammation causes worse movements, and sometimes I find patients stuck in this perpetual cycle. Now, luckily, modern medicine has a great solution for this, where if chemical is blocking us from getting to that mechanical source, well, we could take something like a medral dose pack, which is an oral steroid, or a corticosteroid injection, and that'll wipe out that chemical from playing a major role. So then, as clinicians, we can get right into the mechanical issue that's causing that inflammation in the first place. Now, the issue is, a lot of people start to attack the chemical cause before the mechanical cause. So if you have a debilitating, painful injury, if you go to the doctor, they prescribe a medral dose pack, or they send you to a specialist to get a corticosteroid injection. If that takes away your symptoms right away, then good news is you helped with the primary cause of the symptoms you're feeling, but not the primary cause of why the inflammation is there in the first place. So this is very important, because every now and then a patient comes in and I just know chemicals winning. So the first line of defense is we want to refer them to get some sort of anti-inflammatory, especially if over-the-counters aren't even touching it. So then we'll refer them out to get rid of that chemical, and then guess what? 50% of those people don't come back for their follow-up appointment, and guess how I see them a month from now? right back where we started because we never solved the mechanical issue that's causing that chemical irritation. So super important. If you have a lot of musculoskeletal pain, this might be a huge solution for you, but it's only one piece in the puzzle. So if you know someone that has to get a corticosteroid injection like once every 3 months for knee pain, back pain, whatever it is, they're just slapping a Band-Aid on it over and over again and not getting to the true cause of that inflammation. Sorry to nerd out on you right there, but it's super important if you want to know how to manage your musculoskeletal pain disorder. So I'm going to put a percentage on this. I already said this is about 90%. I would say the next is chemical winning. Again, chemical's always involved, but chemical winning, where we can't even touch the mechanics yet, is about, I would say, 7.5%. Less than 1 out of every 10 people I see do I have to refer them for some sort of steroid or a strong anti-inflammatory. So you can see this compiles a majority of most musculoskeletal disorders. Now there is a few more, so let's go to number 3. And that's where we have a structural driver of your pain. So actually everybody thinks this is the #1 cause of their pain, but man, are they greatly mistaken. Especially if someone has severe pain, they want to go MRI it right away. Again, I see the logic there, because if you have that much intense pain, you're like, there's got to be something major going wrong. But from my experience, if you go structural first, aka trying to get an x-ray and then an MRI, usually they'll find something that they can operate on, and that's where we get 50% of surgeries unsuccessful, because maybe they didn't need the surgery in the first place, especially when it comes to spinal surgeries. This also leads into another common question I get from patients in the clinic, where they're surprised that we don't do x-rays on the first visit. Well, as a skilled musculoskeletal clinician, I'll know what's the main driver of your symptoms, and very rarely is it structural. So I'll put this at a solid 1.5% of patients I see. Actually, in the last 12 months, I don't think I've referred any patient out for imaging, because usually we find what their main driver of pain is just based on going down this list. Now, full caveat, I'm not seeing a lot of people coming from, say, a severe car accident or a lot of traumas. So more structural injuries will likely end up in the ER first, and they'll go through their imaging classifications there. But just as someone dealing with your average musculoskeletal injury outside of trauma, you just woke up with pain someday, or you threw out your back just trying to put your shoes on, 1.5% of those incidences, at least from my clinical experience, is very rarely a structural issue. Now, before I get to number 4, there is fluidity to this. So I already mentioned that mechanical can cause chemical. Your structure can also make you more susceptible to mechanical issues. So if you already know you have arthritis or a limited range of motion in certain joints, that could limit your mechanics, and that can also cause mechanical pain. The information I'm sharing is based on what's the primary pain driver, because usually it's 80% this, 15% this, and then maybe 5% is from the actual structure itself. So let's recap before we get to number 4. So mechanical pain, this is where your sports chiropractor or your physical therapist, specifically ones that are certified in mechanical diagnosis and therapy, otherwise known as the McKenzie method, they will be able to sniff this out pretty dang quickly, usually within a week, all right? And then I'll know within 1 to 2 visits if we can even fight the mechanical issue with a mechanical solution, aka the right rehab and treatment strategies. If we can't get it to budge, then I'm automatically thinking, hey, they have a high inflammatory component to their symptoms, so let's just go to your primary care, talk about getting a medrol dose pack or some sort of steroid, so then we knock that chemical down, but then we've got to get right back to the mechanical source. So if we can't budge through the mechanical cause, and we take a corticosteroid or a medrol dose pack and it doesn't get better there, then that's where we want to go MRI or some sort of advanced imaging, just to make sure there's no structural pathology causing your symptoms. Now, if you make it down this list and your image or MRI comes back normal, they're like, hey, your shoulder's completely clean, but you've been dealing with chronic pain for a little bit, then that leads us to our 4th and final, and that is a behavioral cause of your pain. This starts to get into the weeds with more of chronic pain, so if you had symptoms for 3+ months, you may have some behavioral components as the lead contributor to the symptoms you're feeling. What do I mean by behavioral? Well, within this, we lump certain stressors. So if you have extra stress in your life, usually you're in that fight or flight or sympathetic tone, and that loves to deposit symptoms where you already have an issue. So you could have a mechanical issue, but based on what's going on in your life right now, it's throwing gasoline on the fire, and there's a reason why you're not getting better, or all of these didn't help you in the first place. Or other behavioral things would be like posture, for instance. So let's say you're a truck driver who has to sit a majority of your whole entire day, and you have chronic back pain. Well, you're probably not going to solve the issue with this stuff if we're still sitting for long periods. So that's where we got to get smart about implementing the right movement strategies and breaking up any of those behavioral causes. Again, this could be a whole educational series on its own, so I'm trying not to go too deep into the weeds since this is just an overview of each of these. And then I'll leave this at a 1% of what I see. Again, you can have behavioral factors like posture, what activities you constantly do that may contribute to your symptoms. Those could lead to mechanical, which then lead to inflammation, and your structure could also dictate your mechanical stuff. So you can see this is an intertwined web. I'm trying to make it as simple as possible in a linear fashion, just based on how common I see these in the clinic. Whew, that was a lot of nerding out on you, but hopefully this made sense to you, where if you're struggling with constant musculoskeletal pain, that you'd want a structured step-by-step process, especially if you started here and you got an MRI and everything's normal but you still have pain. You likely need to move back up the ladder and try to figure out the more common causes of your symptoms before just having a random surgery just to have a random surgery. Now, if you would like me to do a deep dive into each one of these, this is kind of more of an overview video, let me know in the comments below. Again, there's fluidity to this stuff, but if it would make more sense for me to make a video on mechanical, chemical, structural, behavioral, and then dive into the major components of each of those, I would love to share that information with you. Also, in this educational series, if there's anything specific you want me to talk about, whether it's how to exercise if you're dealing with a current injury, or the signs and symptoms when you want to get an MRI, let me know in the comments below, and I'd love to keep giving you educational content that helps you navigate your own body.